When it comes to healthcare, women take more time and attention, especially when it's their bodies. Now today we are at Ennu Life with co-founder Lisa Ennenbach. Now, so many people out there want to take control of their health so badly, and a lot of people are scared of aging. But when it comes to those symptoms that a lot of people have, it's just aging, that's not always the case, right?
No, absolutely not. So aging is not normal, like feelings that you have, the things that you're going through, hot flashes, feeling tired, feeling depressed, not feeling like yourself. In many cases, women feel rage, just like they can't control their bodies. So that's something that we will work on with them when they come in.
Now we always hear the term perimenopause and menopause. So what's the difference between the two?
So perimenopause is that time before menopause where your hormone levels start to decline. So you might need certain hormones, and there's certain ones that we don't give until after you go into actual menopause. So it's the time before menopause, but you're still having symptoms. Maybe you can't sleep through the night. Maybe you can't lose weight like you used to. I'm doing everything I used to do. I'm eating right and nothing's working. And then menopause, I hate to say it, is even worse because then you completely lose your estrogen. It is gone. That is not healthy. Some lucky women will not have symptoms at all, but most will. Hot flashes, like I said, not sleeping, not being able to lose weight, et cetera, et cetera. But your hormone levels, whether you're having symptoms or not, when they're declining, that's not healthy. You're not preventing disease. Your bones are deteriorating. It's not protecting your brain, your heart. We just talked about what's the #1 killer of women, heart disease. And we now know for sure, we've been doing this for 15 years, and I've been preaching it forever, but now it's all out there, and I'm really glad that the information is out there. But you want to go to someone with experience that knows what they're doing, that knows hormones. Medical doctors get maybe 1 hour of hormone training in med school. Maybe. 1 hour? Maybe.
And you get 1 hour to 2 hours with the patient, one-on-one.
Right, yes,
and
yes.
Normally you get maybe 5, maybe 8 minutes with a doctor. I mean, that's just so crazy because it is so important for women to really, again, take control of their health.
Yeah, and your doctor's looking at you, your regular doctor saying, well, all your labs are normal. Okay, we don't want normal, we want optimal. That means having what you had when you were 25. That means preventing those diseases. That means getting rid of those symptoms. That means transforming your body into the best version of yourself. Imagine being able to come in, spend an hour to 2 with us, and then a month later, you feel like a completely different, transformed person.
Wow. I mean, there is life on the other side of that treatment. And how long would you say a treatment usually takes for someone? Is it kind of individualized, would you say?
It's all individualized. Usually women, we treat men as well, and that's andropause. We might get into that.
Yeah.
But women usually take about a month or 2 to really kind of see the changes, just because we have 3 major hormones that we need to kind of correct and get those in the perfect balance for you. Not everybody's, is at the same level, feels the same. So it might take a few more months for women. Men, it's just easier for everything. They lose weight quicker and put on muscle quicker, but women, we have a little bit harder time.
So many people want to go out and get their labs done, and most of the time people come back with just normal results. But you mentioned optimal is where we want to be. So why is that so important?
So important. So normal for your age and not optimal means that you are not protecting your body. Your brain's not being protected, your heart's not being protected, your bones aren't being protected. When we're younger, we have healthy bones, we have mostly healthy brain, for the most part.
Yeah.
Your blood pressure's not up, all of these things. So when you're not optimal, then those things, your body doesn't function as well. You have to replace those hormones at an optimal level to be able to function, do the things that you want to do, be the most healthy. And again, you may not have symptoms. So don't think if you don't have any symptoms at all, what's $99 to get a health check?
Right.
I mean,
it's probably the best $99 you'll ever spend to sit down with one of your team members to go over everything. We kind of talked about those symptoms, and the hot flashes, of course, is probably the #1 a lot of women experience. But even if you don't have those symptoms, something could still be wrong.
I can't express that enough. If you don't have symptoms, most do. So most people come in for symptoms, but really we want to prevent future disease. We should not be getting high blood pressure and diabetes and heart disease and all these things, especially at younger ages. So we're trying to prevent those. Dementia, that's really important. Of course, a lot of women and men, experience that. And we want to take care of that.
All right, Lisa. Well, thank you so much for having me out today.
Thank you for having me.
All right. So again, to learn more, just head over to their website, ennewlife.com.